Thank you for joining us today. My name's John Phelan. I'm economist at the Centre of the American Experiment, and I'm very, very pleased to welcome today Chris Phelan, who is a professor of economics at the University of Minnesota and chair of the Department of Economics there. We're going to be talking about COVID-19, the economy, Minnesota's economy perhaps specifically, and the impact of COVID-19 on the economy, and what we can do to try and get our economy moving again. So Chris, thank you for joining us today.
Great to be here.
I think the first question I'd like to ask you is one that I've had put to me a couple of times. This is a health crisis. Why, as an economist, are you getting involved in this? What do you bring to the table?
Well, this is the biggest economic event since the Great Recession. We're seeing, at the beginning of this, I was predicting we might have 25% unemployment, which is what we had during the Great Depression in the 30s. So economists have a lot to add to this argument. One thing that is also true is at least the simplest epidemiology models don't look very different than the kind of models that we teach to our students and that we use ourselves. So there's actually been a big growth industry in the last 3 months in the economics profession, probably over 100 or 200 papers written that try to take epidemiology models, which just have like a biological side to them, and add an economic side so that we can consider costs and benefits.
Yeah.
So that's one of the things I think that economists can bring to the table. We're pretty good at cost-benefit analysis, or at least setting up the problem so that we can discuss costs and benefits. One of the things that I've been pushing is that almost all the costs of this are being borne by young people, and almost all the benefits are going to old people, or especially the very old. The costs and benefits of the government policy of locking everything down.
Yeah, that's an excellent point. We'll come to the generational point a little bit later on. One thing that struck me is that whenever you try to talk early on anyway, I mean, things have changed a little bit, I think, as the debate has moved on. But early on, when these kind of measures like the stay-at-home order that was put in place in Minnesota on March 25th and has been was extended several times after that. But early on, whenever you try to talk about costs and benefits, people thought you were some kind of granny killer. So I would say to people, for example, there is a big economic cost to what we're doing, and it's worth asking the question, what's the trade-off here? But it seemed that there was an awful lot of pushback on that. And I saw this actually from some sort of high-profile Twitter economists who thought you were a terrible person if you even raised the possibility that economics might approach the question from that direction. I don't know if that's something that you saw.
So I made a decision a few years ago to get off of all social media, especially with any econ colleagues, and I don't regret it for a second. It's, I guess, the way economics changed on how we discuss things with each other, which I'm sure you know, which is in maybe the 40s or the 50s, people used to write long books. And then we went to journal articles and conferences. And so now we're doing virtual conferences. And in the virtual conferences that are going on for COVID and economics, there's none of that. There's explicit modeling of the trade-off. I mean, one of the things, if you put down, there's a lot of people that don't like mathematical models of all this, but it does make you point out exactly what you're assuming. And somewhere in these economic models, you have to put down how much you value a human life. And one of them is putting down every time we should be willing to give up $11 million for each human life saved by some policy. If you do that, you can actually get lockdowns maybe from 3 to 6 months as being, quote, worth it. I think $11 million, we don't spend anything near. If we were to be consistent and be willing to spend $11 million for every life saved, we would have a much lower speed limit. There's a bunch of other things that you can look at and say, we don't do that everywhere. But I would say that among ourselves in economic conferences and virtual economic conferences, I think we're pretty open about putting down what assumption we're making. And I guess I'm going to be a little bit dismissive here. If you're going to say something like, it's worth spending any amount of money for any human life, please go sit at the kids' table.
Yeah.
Every rational adult conversation about this is going to have to require that we just admit that there is a trade-off between economic activity and lives saved. We do it for speed limits. We understand that, we lose probably, I don't know the number off my head, but I think it's about 30,000 people a year in traffic accidents. If we were willing just to make the speed limit 20 miles an hour and rigorously enforce it, we could save tens of thousands of lives a year. And we don't do it because of the economics costs. We as a society do the kind of trade-off that you're claiming that people on Twitter say is immoral to even consider. Well, fine, we do it all the time.
Yeah, that's one of the things that I come across when I talk about public policy a lot is, if it saves only one life, it's worth it. That has always seemed to me one of the kind of just silliest things you can say. I can kind of see where it comes from on a gut emotional level, but in terms of analysis, it's next to useless.
I agree.
And there's so many issues that feeds into. So I think the first thing that I'd like to try and discuss with you with regards to the COVID and the economy specifically would be the question of the initial lockdown. Because I know you wrote about this for the Star Tribune. The initial lockdown, like I said, that went into the stay-at-home order. It went into effect, or it was announced on March the 25th. And it was supposed to run up, for up to about April the 10th, I think, was the original expiration. It was extended subsequently a number of times after that. What were your thoughts on the initial lockdown and, how that was done?
So what I wrote with my colleague, V.V. Chari, on the initial lockdown was to try to get some sense of, we should understand why we're doing this. I guess I have two thoughts. One has to do with honesty and one has to do with why are we doing this? One of the things, so I immediately jumped into all these epidemiology models. And one of the things that comes straight out of their own models is a big lockdown for a few weeks or a few months, followed by opening up again. Doesn't do anything in their own models, not my models. In their own models, shutting down really hard and then opening up to where you were before just puts off the pain for as long as you shut down. Because you're basically, at the beginning, you've got a small number of people who, if you allow all sorts of interactions to happen, will run the risk of infecting everybody else. Okay, now let's lock down for a month. And how has that situation changed after a month? You still got a small number of people infected who, if you let things out. So we came right out and predicted, like 9 days after the thing started, the lockdown started, we came out and predicted that this is just going to be a cycle of 3 weeks later, we're going to be in the same situation, so we're going to stay locked down. 3 weeks later, we're going to be in the same situation, so we're going to stay locked down. And so what we were advocating at the time, which I don't think happened, was that we at least use the time, the limited time of the lockdown, to change the facts on the ground. So for instance, maybe it makes sense to lock down for 3 weeks if you don't know what the hell's going on. And so if you don't know what's going on and there's horrible things happening in Milan, maybe it makes sense to just use that 3 weeks to figure out what the heck's going on. Do random testing of people. So you at least know how many people are infected. Did they do it? No. One of the things we were pushing was South Korea and Taiwan seemed to be doing a really good job. Maybe we can use those 3 weeks to find out what the heck they're doing. They had a whole government system of contact tracers. So if you came down with it, they'd find out where you were and try to get those people to isolate and so forth. So we said, okay, maybe we can use the 3 weeks of a lockdown to build up some system that they have so that we don't lock down everybody. We just lock down people we've known had contacts with someone with COVID. Did we do that? No. But our general thing was a lockdown, unless you're willing to do it forever, which would just have astronomical economic costs, only makes sense if you're going to use the lockdown to do something with the time you're buying. One of the things that they probably did do was build up some hospital capacity. So
yeah, that's an interesting point about the hospital capacity, because that was reported repeatedly. You know, for every extension, it was said that we were trying to ramp up surge capacity. I mean, the models that they've used, version 2 and 3 of the model, both forecast a peak ICU usage of mid-July, July the 13th, I think, of 3,700 beds. Now we have to have a massive kind of, increase from where we are now to get anywhere near that. And that's with the measures that were put in place. That's with the various lockdowns that there were, and the stay-at-home orders. And we're nowhere near that. These models have been way off, really, particularly in terms of mortality, and it looks like also in terms of hospitalization as well. So they bought this extra time. And one thing that surprised me is on April 29th, Governor Walz did announce, well, we've done it, we've cracked it, we've got enough ICU capacity now so that anybody, when our surge hits, who needs ICU bed is going to get one. That was April the 29th, and then we went and extended it again anyway. On March 25th, when we put the lockdown in place, it was said we need to do this to build up surge capacity. On April 29th, we were told we've got the surge capacity now, but we still then had this extra lockdown. And it seemed to me at that point that the lockdown was a kind of tactic in search of a strategy. We were just kind of pursuing it and wondering what's next.
I think that there's something to that. There is the idea that maybe you can get the infection rate low enough so that a small number of state workers could kind of play whack-a-mole after that. That does seem to be what is going on. But we're pretty far away from that. And it's still the case that are you going to keep foreigners out forever? So it's like I said, the first Star Tribune article that we wrote just said, please have a plan for what you're going to do on this. And I didn't see it. The other thing I wanted to touch on was, and you're correctly pointing out that the models made predictions that didn't come to bear. This is, for anyone who works with these constantly, that's not a surprise. I guess I would have wished, so I'm an advisor to the Federal Reserve Bank in Minneapolis. And if somebody says to me, we're printing a lot of money now, which we are, is that going to cause a huge spike in inflation? I would give my answer, which is maybe.
Yeah.
It's happened before. It's also been, I guess I would put it this way, that all huge increases in prices go along with huge increases in the money supply, but not all huge increases in the money supply correspond to huge increases in prices.
Yeah.
But the point is, if somebody asked me that question, I would want to be upfront about what I don't know. And one of the things that economists are really bad at doing is predicting. I think it was Milton Friedman who said that economists' track record with predicting should cause nothing but humility.
Yeah.
And we're just not good at it. And so when it comes to predicting, we should just say we're not good at it. And I did not see that when it came to the epidemiologist. The way I would have put it when they come up with something like we might have 1.6 million dead of this disease was, I can't say for certain, but these models don't have ridiculous assumptions. And there are scenarios where you get 1.6 million dead from this. Are we saying that that's going to happen? No, but we're saying maybe it could. It's not ridiculous to think that it could. I didn't hear any language like that. I heard language like shutdown and we're going to get 1.5 million dead. Yeah,
one thing that I see, and it's quite bizarre, is that people defend these models now and their predictions by saying, well, it's not meant to be exact. It's meant to give you, just a kind of direction of travel. Now that's wrong, it seems to me. I mean, any fool you could walk into a bar and find some guy who will tell you that if you've got a really contagious infectious disease, if you lock everybody in their houses, it will spread slower. You don't need a weatherman to know which way the wind blows, as a famous Minnesotan once said. And you don't need an epidemiological model to tell you that. And so, but a successful model shouldn't just give you a direction. It should give you some idea of magnitude as well. And it seems to me that in this case, that's where this model has completely failed. And this is a model, I mean, people now try and downplay it and say, well, it's just one of many things that we're looking at. Well, they weren't saying that early on. Early on, they were touting this model. They were very, very proud of it. And they were, parading it around because we had our own. We weren't relying on these other models that were, predicting from Washington or anywhere else. We had our own model, and it was, this fantastic thing. But it's been a dog. Let's be honest.
Sure. Models are, again, they're extremely good at telling you the exact implications of your assumptions, which is not actually as trivial as it might sound. The number of times in my own career where I've just assumed or I've just said to my colleagues, well, I'm sure if we just put into the model A, B, C, and D, we're going to get E. And I was wrong. The whole point of it is to discipline your thinking so that if you assume A, B, C, and D, the model tells you what the implications are because they're not easily guessable. So it was good for that purpose. And like I said, the assumptions that I do like the fact that they call it the University of Minnesota model. Universities don't actually speak. There's no such, if a colleague of mine want to make an economic model of the world and call it the University of Minnesota economics model, there's nobody to tell me I can't do that.
Yeah.
So I don't think any university object put a imprimatur on that and said, this is the University of Minnesota epidemiology model. It is good for what models are good for, telling you what the implications of your assumptions are. My guess is originally when they did it, the assumptions were not crazy, but these models also you make small changes and not crazy assumptions, you get huge changes in the implications.
Yeah.
So I think the mistake was pretending that this is, quote, science. And if you don't agree with the University of Minnesota epidemiological model, what are you, against science?
Yeah. Yeah.
I call that academic bullying.
Yeah.
I have a PhD. Most of these people in the audience don't. Therefore, just shut up and listen to me. I'm right, you're wrong.
Yeah.
That's academic bullying, and it's bad for everybody.
Between two of the versions of the models, for example, ICU capacity grew, and I was talking to somebody about this recently, and they said, oh yeah, they just kind of magically, grew ICU capacity. But if you look at the assumptions, you can see exactly where it came from. Originally, they were basing the length of ICU stay on data from China. Now, for various reasons, somebody who goes into ICU with COVID in China spends longer than somebody who goes in New York. And when they redid the model with new data from New York, they were able to shrink that ICU stay, which in effect increased ICU capacity. But I think that goes to highlight your point. This is a brand new disease that we don't know very much about. So everything we come up with in terms of a prediction is going to be speculative. These parameters are unknown. And we have given far too much weight to the predictions that they generate. And also, just to go back to your point about bullying, I mean, we've all seen it, the science, the data, the science. But that doesn't tell you what to do as a policymaker. The science, if you assume that these models are substantially correct, then what they tell you is if you do X, Y will follow. But that's not a political prescription. A politician then has to decide, a policymaker then has to decide, well, do we want to do X as a payoff, as a price for Y? That's a different question. That's a political question. And it does seem to me that what they're trying to do is take normative questions of policy, should we do this, and turn them into positive questions, which is wrong.
I agree. So Larry Summers, he's an economist who's the former president of Harvard, gave a talk at the Minneapolis Fed, and he had a wonderful, there's an expression, war is too important to be left to the generals. And it's true, just because you know how to win a battle doesn't mean you should be the one deciding whether to fight the war in the first place. But he added to it and he said, economic policy is too important to leave to economists, precisely because there's value judgments. We might be able to tell you what the costs and benefits of doing this or that are, but how you weigh them is probably something for the political system. And then he ended it with epidemiology is too important to be, or epidemics are too important to be left to the epidemiologists.
Yeah.
They can tell you what they think might happen if this is true, or that might happen if that is true. But the idea of weighing off the costs and benefits of shutting down an economy versus, maybe it's obviously you shut down the economy, you're going to get a lower spread of the disease, at least as long as you're shutting it down. Whether that's a good idea requires economists, it requires policymakers, it requires the citizenry to weigh in.
Yeah, I sometimes wonder how many of these people who say that politicians should just blindly listen to experts would have supported MacArthur when Truman fired him for wanting to invade China during the Korean War. I mean, I wonder how well that would have panned out. One of the points that you've made, to kind of move on a little bit, is that the costs of this are huge, in terms of unemployment, lost output and incomes and all the rest. But they're not evenly borne across the population, and that there are some sections of the population which are suffering more than others. I've written on our website about research which has shown that minority businesses and immigrant-owned businesses are suffering disproportionately from all these measures. But you've talked a lot in some of the stuff you've done for the Star Tribune about the generational aspect, and you mentioned it earlier. So would you like to talk a little bit more about that?
Sure. So should we open up the university? I've been in my own university a big proponent of just opening up and allowing, I'm of the age 57 where this starts to be a danger. 67 is worse, 77 is really bad. But the probability, no probabilities are zero, right? But the probability of somebody under the age of 30, which is just the vast majority of our students, or 35, the vast majority of our students and graduate students, dying from this isn't zero, but it's pretty darn close. Right, so any idea that you keep schools closed for the benefit of the students, because this is dangerous to the students, is either deluded or dishonest. Keeping universities and schools closed for the professors and the staff might make sense, but we should be clear that we're not doing it for the students. But if you start looking, okay, what are the costs? Well, unemployment. But most of the people most danger of this disease are of the age where they're no longer working anyway. So they're not going to get laid off. The people who pay the cost of unemployment are the younger people who this disease isn't dangerous to, or nearly as dangerous to. Things like that are never counted in the calculations are schooling actually works. Maybe I'm patting myself on the back as a college professor, but all of the data that we have says if you go into a country and give people another year of education, maybe 9th grade to 10th grade, there's just big effects to make it worth it. There's big effects of going to college. There's huge effects for early childhood education. And we just kind of said, oh, but because of a disease that poses no danger to preschoolers, kids can't go to preschool, which affects them their whole lives. We're getting some good data. Raj Chetty at Harvard has this website called tracktherecovery.org. And the best data we have, it's not good, but the best data we have on how well schooling is doing remotely is not encouraging at all, especially for low-income kids. So a lot of schools, you go onto a computer and you do math lessons. And if you complete the math lesson, you get a medal. And they have data on how many medals are being awarded for completing your math lesson. And as soon as they did the shutdowns of school, where they would used to do it on the computers at school, and now you do it on the computers at home, on average, it basically fell about 50%. But they also, okay, let's do it by high income versus middle income versus low income zip codes. And it fell maybe 30% in the high income zip codes, 50% in the middle income zip codes, and fell off a cliff in the low income zip codes. It's kind of evidence that at least for low income kids, when they closed the schools and went remote, it's the same thing as closing the schools. So low income kids just aren't getting educated now. And if we don't open up the schools in the fall, and every bit of data that we have on this says that not educating kids, especially not educating low-income kids, because high-income kids, their parents kind of step in and do it for them anyway. But low-income kids, you keep them out of school, this affects them for the rest of their life.
Yeah. Yeah, I was just writing something for our website for later this week about the research that there is on graduates and people who graduate from high school and colleges during recessions. And the average the kind of finding is that you experience, if you graduate during a recession, you experience a depressed income for about 10 years, some estimates from 8, some to 15, but 10 is kind of like the average. But there's also a report or a study that came out from, I think it was 2 economists at Stanford last year, that found that students who graduate during recessions, they don't just have low incomes for an extended period. They actually have all kinds of, health incomes that spiral off that, which are lower. They smoke more, they drink more, they do more unhealthy stuff. And so these things, this isn't a cost that we see immediately now in a high unemployment rate now. This is a cost that we're going to be living with for years.
Yep. This has been known in labor economics for a while, that graduating during a recession, like you said, that's the general, boil it down to one number thing. It will depress your wages for 10 years. The other stuff, higher rates of alcoholism, drug use, I didn't know about. I'm not surprised at all. I actually gave, I'm a little embarrassed by this. I gave a interview last fall. Someone asked me for the student newspaper, should college graduates be nervous about their job prospects? Today's seniors last fall. And I said, well, it's always a good idea to have the appropriate level of nervousness. You should always be a little bit tense and trying to do your best. And I did mention exactly this, that graduating in a recession is bad. But on the other hand, we're in one of the best job markets that we've seen for the last 30 years. Because it was last November.
Yeah.
So, I probably did my usual caveat, you never know. But things are looking pretty good for you guys. Maybe I should have knocked on wood.
Yeah, I don't think anybody would blame you for the pandemic, but it's one of those things. Absolutely. If you go back to the tail end of last year or January this year, I think if you'd have said to a room full of economists, what's your big downside risk for the economy in 2020, probably none of them would have said, global pandemic. I know you can find a couple of people online who've said that, but you can find people online who've said almost anything. So when we've got the issue, of this generational theft thing that you're talking about, what do you think that we could do to kind of remedy some of that?
So I told you, there's a joke. First of all, the virus itself is going to cause decreased economic activity.
Yeah.
Even if there were no shutdowns, people not going to work, there's something I'm sure you know about called the sectoral shift hypothesis, which is if everybody goes from wanting oranges to everybody going to wanting apples, and the economy's set up to produce oranges, there's going to be a retooling. So there's going to be some of that going on. People are less likely to want to go to restaurants, less likely. So that means we have too many restaurants, maybe. Less likely to want to go on vacations. So maybe we have too many airplanes and too many hotels. Right? So that's going to cause a decrease in economic activity as it starts. But a lot of it is, I use this, I always tell my students, there's one thing about economics jokes, and they're not that funny. But there's a very old joke about a doctor saying, hopefully I'll get this in the camera, doctor, every time I do this, my elbow hurts. And so the doctor says, don't do that. So that's probably, my best economic recommendation is, for the most part, we're doing a lot of things to the economy to purposefully suppress economic activity. We told people you can't have your factory. You can't. So one of the things that makes this a rather odd recession is most recessions are associated with gluts of goods. Factories shut down because they're trying to produce, but then nobody wants to buy their product. And the inventories start to build up and they say, okay, we have to shut down. We're not selling anything.
Yeah.
the fact that in the middle of the recession, you can go and they've run out of stuff at Home Depot. They've run out of stuff in the restaurants, sorry, in the supermarkets. That's odd. And that's because we've, literally said to factories, you guys got to shut down. So that's what I mean by don't do this. Don't tell factories they have to shut down.
Yeah.
Allow stores to open, allow restaurants to open. Things will still be depressed because people will voluntarily not buy the same things that they were doing. They'll voluntarily stay home more. But it won't be as bad.
Yeah, one of the things that I noticed when I looked at, I think it was version 2 of the model, just to go back to that for a sec, one of the extensions of the stay-at-home order, I can't remember exactly which one it was now, maybe the one up to May 4th, but there were 2 scenarios that the model modeled. One was scenario 3, which was a long-term stay-at-home order for the most vulnerable, so the elderly and people with underlying conditions. And the other scenario was scenario 4, which was another 4 weeks of lockdown. Now, we went with scenario 4, not scenario 3. Now, obviously, scenario 3 would have allowed for, much greater opening of the economy a lot earlier than scenario 4 did, which we went with. But what really struck me about these 2 scenarios, when you look at them in the Minnesota Department of Health document, is that both gave you exactly the same number of peak ICU usage, 3,700 beds. Both gave you exactly the same number of estimated mortality, 20,000 deaths. The only difference was that under the total lockdown, scenario 4, the peak came in July. And in scenario 3, it came, I think, sometime in June, mid-June maybe. So that's essentially, when you talk about, stop doing what you're doing, we've made very deliberate choices along the road to do this when other alternatives have been available. It's quite obvious, if you look at the numbers, that this is, a disease whose really bad effects in terms of mortality are concentrated amongst a very definite share of the population in terms of age and in terms of underlying mortalities.
So one of the economic policies that I've been pushing is, now this came at the end of one of my op-eds, I guess you can separate people into 3 groups. There's the people that this really isn't just that dangerous to. Then there's the people who it's dangerous to, but they're functional enough that they can more or less isolate. So suppose that you're 85 years old and in relatively good health, either living at home or doing independent living. You have an apartment, but maybe somebody cuts the grass, the association cuts the grass for you. These people can on their own isolate. They can have food delivered to them, groceries delivered to them, things, use Amazon and stuff like that. So you don't actually have to, and maybe they're 85 years old and say, I'm not going to spend the last, 1/10 of my remaining years locked up in an apartment. I'm going to go out to restaurants. I'd like to say it's a free country, but it used to be. In any event, if somebody's 85 years old and wants to make their own choice about weighing off the risks and benefits about going outside, that's fine. The real problem, and this is where 80% of the deaths are in Minnesota, about 40 to 50% in the world, are the vulnerable population that can't isolate themselves because they're too debilitated.
Yeah.
So if you're 85 years old, but in a nursing home, you're in a nursing home for a reason. You can't dress yourself. You can't feed yourself. You can't get to the bathroom yourself. That's a really tough problem to solve as a society, because you can't just say, okay, let those people voluntarily isolate themselves. And that's where, and because they can't, and then the care worker gets it, that's where we're seeing 40 to 50% of the deaths worldwide, 80% in Minnesota. So I would say public policy just should be find a way to protect them. Look at it this way: the cost benefit of simply saying, if you're worried about nursing homes getting infected, maybe we should just pay people 3 times their salary to be there 24 hours a day. People agree to just get tested and then not leave the nursing home for 2 months and give them a boatload of money to do it. If that could have, the cost benefits of whatever you're paying to get people to isolate for 2 months and help in a nursing home, it's going to be worth it if the alternative is shutting down the state.
Yeah, well, this goes back to your point that you made initially about your op-ed, where you talked about, we need to take the time for the initial lockdown to think a bit strategically about what we do, and we didn't seem to do that. And to the extent that we did do that, we seem to have completely dropped the ball on nursing homes. I'm glad you brought that up, because I was going to segue onto that next. For all the vast costs that we've incurred in terms of, economic output, and that young people will continue to incur for the next 10 years at least, we haven't done anything, it seems to me, to mitigate the situation in Minnesota's care homes, which is kind of, the epicenter of all this. As you say, 80% of all our state's deaths have occurred in care homes. I think that's the second or third highest share nationally. We've had more deaths in our care homes in this state, the last time I looked, than 30 states have had in total. And we've been following these policies, sending patients back in. And there are particular things with our care homes, actually, than the way they're built. And so for all this huge cost, where we could actually have really reaped some benefits, we apparently did nothing.
I agree.
Yeah, it's absolutely scandalous, really.
The only thing I'm wondering is, maybe, this is me just completely speculating, is if you're just being told the hospitals are going to be overwhelmed, the hospitals are going to be overwhelmed, the hospitals are going to be overwhelmed, then you try to think of ways of getting people out of hospitals. So now you got an 85-year-old who needs nursing home, was in a nursing home, brought to the hospital, isn't in danger anymore, still has COVID, still is infectious, but doesn't need to be in the hospital anymore because they're going to get over it. Well, if you're worried about hospital capacity, get them back into the nursing home.
Yeah.
And I think that the states like New York and Minnesota that have these crazy policies of, the obvious thing to do is either set up nursing homes which have only COVID patients in them, or don't send them home from the hospital. Because sending someone who has COVID back into a nursing home environment is, at least with 2020 hindsight, insane. Yeah.
We spent $7 million on a big building which we're going to use as a morgue for overflow for apparently all the COVID deaths which are about to hit us, if you believe the model. And as you say, it would have been much better to take that $7 million and kit some facility out to be a kind of COVID clearinghouse for nursing home patients, so that we can separate them out from the rest of the population and isolate them. It really seems to me, fighting COVID should be, nowhere should it be easier than when you have a population that by definition is locked down anyway, is locked down. And the nursing home population, it kind of lives locked down. That's the point. And we completely fail to do anything there. It seems to me, anything meaningful.
Great.
Yeah. So I think that's a huge scandal, and it ought to be a scandal. And I crunched the numbers a little while ago, and that if you take the median national death rate in care homes and applied it to Minnesota's care homes, because obviously our median death rates above that, I think that we work out something like 200 excess deaths. Now that's a couple of years worth of Minnesota homicides, roughly. And so this should be an absolutely huge scandal that nobody really seems to be all that interested about. And just as a final point, I think the media here do a fairly poor job of holding our leadership to account. They will just sit there and swallow anything that they get told by the state government. Well, we talked, now about the nursing homes. And one thing I'd like to talk to you about a little bit more is, as we kind of talk about policies moving forwards, is you've talked about, just stop doing it. And I completely agree with you on that. But there are obstacles in the way, some of which are, for example, these increased unemployment benefits that people are receiving. We hear a lot, and I'm actually starting to see, kind of some academic stuff on this, that employers are competing now with, a wage that they can't match in terms of, what people are earning in terms of unemployment. Do you think that's going to be a big problem going forwards? And if so, how do you think we should go about dealing with it?
Just to so the audience knows the details of what you're referring to, the original several trillion-dollar thing that went through Congress and was signed by President Trump had, if you were laid off, you got an extra $600 a week on top of your unemployment benefits. At the low end of the wage scale, getting your unemployment benefits plus $600 a week is probably more than you were making.
Yeah.
Once you get into the middle of the wage scale, that's no longer true. But if you're talking about a service job, working in a restaurant or something, a lot of those people are better off not going back to work if the restaurant opens. And so, yeah, that's just insane. I mean, some people like to say economics is basically two things. Things have to add up, and incentives matter. Incentives matter. If you pay people, more not working than working, you're going to get fewer people working. So that's just another example of don't do this.
Yeah.
It expires July 31st. I hope that our political system is functional enough not to continue a mistake like that. Who knows? It's enormously expensive. If you want to have any kind of, sooner or later, we're going to have to pay our bills in a present value sense. And so I always like to say spending is taxing.
Yeah.
So I think that it's possible to go back to our old unemployment system. It's not hard to walk into a restaurant and get a job at this point. Two of my kids just did it, which is, again, an odd thing to happen in the middle of a pretty deep recession. Usually it's hard to get a job, not to get a job the day you go ask for it. So we'll see. My guess, I'm hoping at this point, and the stock market is kind of agreeing, that as long as the disease itself doesn't spike in terms of fatalities, we might have a relatively quick economy by doing nothing.
Yeah, yeah. It would be fascinating to see, because I don't know if you can think of any kind of historical examples. I mean, if a stock market crashes, where you can look back at a whole bunch of stock market crashes, if there's a hurricane or something, you can look back at a bunch of hurricanes or a drought or whatever. But it's very difficult to find, I think, a historical precedent for essentially shutting down your economy, putting your economy on ice to fight something like this.
I don't know when we've done this before. There's been a huge amount of recent digging in by economists to the 1918 flu pandemic. That had a very different, one statistic I read was it killed 5% of every Boston male between the ages of 20 and 25. So that really hit the working age population.
Yeah.
It caused big economic effects. The disease itself. And there were some shutdowns, but in the matter of weeks. And there's a little bit of evidence that the places that did it harder did better than the places that did it softer. But again, we're not talking about months of shutdowns. We're talking about, cutting off public events in one place and not cutting off public events in another. That's all I got to say about that.
Yeah, it's a bizarre kind of weird natural experiment to be living through. Well, we've got some questions. We might not get to all of them, but I've got one here that I used to do monetary economics in a previous job. I don't so much of it now, but I'd like to ask you this one. Does monetary policy have a role to play in recovering from the COVID recession?
I guess, I always tell my students, never say that's a good question because it's implying that the other ones are not. But it's kind of what I do. I think that in general, so I know there might be people given this thing that think that gold is a great thing. So most people think that the big mistake during the Great Depression was when everybody wanted to hold money, they wanted to switch their portfolio from holding real estate to holding money, let's say, cash. The problem is there's a set amount of real estate. And if you're on the gold standard, there's a set amount of money. So even though I can do it, we can't switch our portfolio. All you're going to do is change prices. And so what happened is the value of the money went way up in the Depression because everybody wanted to hold money, which just meant the price of everything else went down. There was deflation. And what they were basically, one of the lessons was, if people want to hold more money, just let them have it, print it. And then when they don't want to have it anymore, unprint it. The way you print money is the Fed buys things with newly printed money. And then when you want to suck it back out of the economy, the things that you bought with that money, you just sell. And so I think that the Fed did a pretty bad job in the 30s and did a very good job in the 2008 recession of expanding the money supply based on demand for money and not causing inflation. We're doing it now, and I think they're doing the right thing. Now, it does require the political will later that if inflation starts to creep up, to undo it, to suck the money out of the system by lowering the Fed's balance sheet. And I worry about whether they're going to be willing to do that when the time comes. But so far, so good. So I think that, yeah, accommodating, I see nothing wrong with the current Fed policy of basically buying a lot of stuff. Because in recessions, people want liquid assets. And if you don't let them have it, you're going to get deflation, which at least correlates with really bad things.
Yeah, it always seems to me that if your demand for money goes up and, as you say, the price of money rises, if the demand for any other good went up, people would produce more of it. So I don't see. It always seems to me that that's kind of a sensible way to proceed with monetary policy as well. We'll move on to the next question now. This is one that says that Trump has shown support for a second stimulus package, which might include another round of checks to individuals. How likely is this going to benefit the economy, especially considering states are moving into reopening?
So I was never a fan of the first stimulus policy. So I'm never a fan of any stimulus policies, all right? But I know what their internal logic is. The internal logic is people are somehow not spending enough. That if we could just get people to go out there and open their wallets and buy something, good things would happen. Well, that's not the issue we were facing 3 months ago. The issue we're facing 3 months ago is that it wasn't we had all this capacity to produce and that people were just not willing to buy it. Is we had all this capacity to produce and the government wanted people to produce less because people getting together to produce was causing infections. So we did, the joke I use is we caused the Great Suppression. We purposefully suppressed economic activity by telling people they couldn't open their factories, they couldn't open their restaurants and so forth. So at the same time, you want to send people checks. Maybe you want it for redistributional purposes. You want government to be some kind of insurance so that the people get hit can still afford food. But in terms of macro, it doesn't make any sense at all. You're trying to suppress economic activity. Why would you then want a stimulus? So I was against the first one. I'm against the second one.
Yeah, it seems to me that it's kind of silly to try and stimulate an economy when you're actually trying to shut it down and just put it into a deep freeze for the period of however long. So that seemed like a strange thing for me. I think I mentioned to you in a previous conversation a policy that the British government had, whereby what they did is they said to businesses, we will match, if you don't lay anybody off, we will match we will pay 80% of your wage bill. We'll cover 80% of your wage bill. And so what happened there is businesses kept people employed, technically not they're doing anything, they were sitting at home, but they were getting paid 80% of their wage. So they took a 20% pay cut. But it's not like you can buy anything at the moment anyway. And so what I think that did, the benefit that had, is that it kept people tied to their employers. What struck me as interesting the other day, I looked at OECD data, and the US economy for the first quarter actually did quite well compared to a lot of other developed economies in terms of the GDP fall. But our unemployment spike was quite high. And I wonder if that's not part of, because we follow this different policy. So we've had this severing of employer and employee, which in a country like Britain we didn't have. We managed to maintain that link.
You're onto something I think is important. I mean, if you're going to, in the end, you're going to end up having at least for political pressure, somebody who, I'm not going to say unemployed, somebody who can't do his or her job because of COVID, somehow money is going to be put into that person's pocket. So the way we decided to do it in the United States was the United States federal government or state government sends a check to that person. That's how the money gets in their pocket. You know, like you said, in Britain and much of the rest of the EU, they sent a check to the employer and said, if you don't fire this person, continue to put money in their pocket, we'll pay you. It's just whether or not the money going from the government to the employer to the employee has the employer as an intermediary. There is a lot of value, and this is something that economics has gotten relatively good at recently, is trying to value something that we call organizational capital. So obviously a machine that, you know, that makes a tool is a piece of capital and it's valuable. But the nexus of relationships that we have has a big value. Look, if you look at an advertising firm, they have basically, they're publicly traded and worth a ton of money. But they have, what do they have? They have a bunch of pencils and chairs, maybe some computers. So you wonder, okay, why is this firm worth so much? And it's because of this, all of the relationships. It's hard to start a new ad firm, but a whole bunch of the value of companies, you can go company by company by company through the United States and say, how much is their capital worth? Their machines, their buildings, their land, and then compare that to the stock price. And they're nowhere close. The stock price is usually, the value of the company using the stock price is twice as much as the value of what the company owns. So one way of saying is that that's the value of all these relationships. And the English policy, the British policy, much of the EU is, well, let's not break up these relationships. And there's some sense to that.
Yeah, another question, and this is slightly shifting the topic a little bit. What are your thoughts about the impact of fear-mongering by the media and also the media impact in general, psychologically on Americans of their coverage of all this?
At this point, I mean, I read the newspaper like everybody else, and I read various blogs and so forth. I have opinions, but I have no professional opinions on that. I have no expertise on the effects of media. I guess there's some data out there that some studies out there that try to quantify the effect of the media, but I'm not an expert on evaluating them. I guess my hunch is it matters a lot, but I don't know why you would have me on Center for the American Experiment thing to give you my hunches when you could just have that guy in the bar give his hunches, because they're probably equally well informed.
Well, maybe the final question, see how we go. This is from me, by the way. The state a couple of weeks ago, or a few months ago now, was looking at a budget surplus, and everyone was running around in St. Paul, cock-a-hoop, what are we going to spend all this money on, or are we going to take tax cuts? Obviously, that conversation is very different now. They're now looking at a deficit, although, you know, funnily enough, it doesn't look yet as big as some people thought it might look. So a couple of questions, I suppose. First is do you think that things are going to be, when you look at these budget numbers that we've got so far, do you think that they are going to get worse so that they match people's worst expectations? Or, you know, instead, might we actually, you know, get off more lightly than we would have expected? And the second question would be, if you're trying to balance the state's books, how should they do it? Should they be raising taxes or looking to cut spending?
Well, they should continue to fund the University of Minnesota. Kidding.
Of course.
I guess I haven't looked at the state budget numbers. The long run, almost all states now are facing long run problems just associated with an aging population and overpromising and underfunding of state employee pensions, including public school teachers. By the way, university professors like me, we don't get a pension. The accounting, we get a 401k equivalent, which One nice thing about 401ks, it does put the risk on the employee. But if I were to quit the University of Minnesota tomorrow, their financial ties with me would be done. They've paid all they're going to pay into my 401k. They don't have to pay me anymore because I quit, and we're done. Most state employees, that's not true because they still owe them a pension, and they've underfunded that. So long term, almost all states have big problems with that. And it gets worse when you have a recession. But, this isn't the last recession we're going to be in. It's not the last epidemic we're going to be in. These things happen about 3 times a century. So I guess the long-term situation of state finances is basically a little worse. But it was still bad anyway because they have all these long-run promises that they've made. The short run, it really helped a lot that we had a big surplus going into this because the deficit that we are going to get is that much less. Yeah, they're going to do the usual things. I don't know what they do. Most states in the United States are not allowed to borrow for non-capital projects. How they're going to deal with that, I don't know. They'll cut here and there. They'll cut where they can cut. University of Minnesota, I assume, is expecting a cut in its subsidy because they cut everybody's salary for a year.
Yeah, looking back at some of the literature that came out of the Great Recession 10 plus years ago now, there was an excellent book by, I think, Alberto Alessina and a couple of his colleagues, Austerity, that came out last year. And it's kind of a dry read, but it's a lot more interesting than anything Paul Krugman's written for a long time. But what they looked at is, countries, like EU member countries, who function a lot like US states in the sense that they can't print their own money, so they have to borrow, in a currency they can't print. And what it looked at is they all had these big budget deficits open up as a result of the Great Recession, and they looked at how they close these budget deficits. So compare countries that try to do it most by tax rises and most by spending cuts. And these guys found very clearly that countries that had tried to balance their books by cutting spending had done a lot better, and that they had done so actually through the investment spending channel. It was their investment spending that had driven their strong recoveries. The much derided confidence fairy that Paul Krugman used to say didn't exist. So I don't know if that gives much guidance for state policymakers.
It gives some. I mean, like I said, the two things in economics are things have to add up and incentives matter. Well, things have to add up, right? You have to. There's no magic way of not paying your bills, and I think it's true for individuals. We all know individuals are lives who think there's going to be some magic fairy that solves their financial problems. And there's individuals who just say, okay, I got to put some money aside. I can't spend more money than I have. There are responsible and irresponsible individuals in their own economic lives. And we know how those turn out. The people who save just do better. I mean, one example, I guess we're almost over, is at the end of the Great Recession, both Ireland and Greece got pretty similar hits. And Ireland basically said, I mean, I hope this isn't too stereotypical. My ancestors are from Ireland, as are yours. Same last name. I think their attitude was like, oh, okay, it was good while it lasted. Now we got to pay the bills. And Greece threw a temper tantrum. And Ireland's turned out a whole lot better. So I guess for United States, particular states, just having an adult attitude of, yeah, we got to pay our bills. Let's just rationally think about how we're going to get that done is the way to go.
Yeah. Well, that is our time up. I want to say thanks ever so much for being a guest. And yes, we do have the same last names. We pronounce them differently. We're no relation. But it's been an absolute pleasure talking to you. I hope our guests have enjoyed it. I know I have. And so, yeah, thanks ever so much, Chris. It's been fantastic.
Thank you for having me.
Thanks a lot.